Hello there, sir. My name is John Whitehouse. I'm one of the final year medical students here at King's. Can I just confirm your name and age, please?
Yes, Tom Searle, I'm 26.
It's Tom Searle, 26. Just check that's the right patient. Fantastic. One of the doctors has asked me to come and see you today, sir, to examine your tummy. That'll involve me just having a look first, and then just having a general feel, and then tapping and listening on your tummy. Would that be alright?
That's fine, yeah.
That's fine. Are you in any pain at all today, sir?
No.
You're not fine. For this examination, I'd like you to just pop your top off for me, if that's okay. Thank you very much. Okay. And if you just sit back comfortably there, this will just start off with me just standing at the end of the bed and just having a look at you. Okay, so looking around the bed, I can't see any paraphernalia that would support my diagnosis, and the patient looks comfortable at rest. Before palpating, I'll have a closer look at the abdomen. Just have a look at your hands, please, to start with, sir. Thank you very much. Okay, so the nail beds don't appear to be clubbed in any way. You just put your fingers together like this. Thank you. And just straighten your nails out. Thank you. Looking at the nails, I can't see any signs of cholionychia or leuconychia that might be present. Just turn your hands over for me, please. I can't see any duopatrons contracture at all, or any palmar erythema. I'm just going to take your pulse. So pulse is about 60, that's fine. Just relax your hands there, so I'm just looking at the forearms to see if there's any signs of AV fistulae present, which I can't see. And then moving up, I've now checked for a blood pressure. Can I get you to just put your arms out nice and straight for me and cock your wrist back? Ideally at this point I'd like to wait 30 seconds to see if there are any signs of asterixis. That's fine, you can relax there. So, can you just pull your eyelids down for me, please? So looking in the eye, looking for any pallor of the conjunctiva, which I can't see, any yellowing of the sclera. Looking around the outside, seeing if there's any xanthelasma or corneal arcus present, which I can't see, thank you. And can you open your mouth, please? So looking at the mucous membranes, which appear to be moist and not dry, there's no macroglossitis, can't see any ulceration present or any central cyanosis. That's fine, you can relax that. Ideally at this point I'd just like to examine the lymph nodes, so just come behind you, sir, if that's okay, and I'm just going to have a feel underneath, so submental, submandibular, anterior chain, posterior chain, anterior auricular, posterior auricular, and then just subsequent auricular there. It's fine, you just relax your head back down now. That completes the peripheral side of the examination. What I'd like to do now is I'm just going to lower the bed down flat, sir, and I'll just have a look at your abdomen if that's okay. So if you just sit forwards for a minute while we lower this down. That should be okay to lie down. Are you comfortable there, sir? And you said you're not in any pain at all. Okay. So, just looking, starting with the chest, I can't see any spine nevi present, more than 5 would be significant, and I can't see any gynecomastia. That's fine. Looking at the abdomen, I can't see any obvious distension, I can't see any scars, any skin changes such as rashes present anywhere, or any obvious masses that I can see. I'm just going to feel gently on your abdomen now, sir, and just moving around all 9 quadrants. At this point, you're just looking at the patient, see if they're in pain, and this is assessing for any guarding or rebound tenderness. Is that okay? So that wasn't too painful? Good. I'm just going to push a little bit deeper now, and this time we're feeling for masses. That's fine. Okay, so now I'm just going to feel for your liver. So what I want you to do, when you feel my hand on your abdomen, I want you to take a nice deep breath in and then out. Okay? And out. And again. And out. And again. And out. And again. And out. And again. That's fine. You can relax now. I'm just going to tap there just to feel for your liver again. So dullness there. And hyperosmotic again. That's a normal size of liver. When you feel my hand again, so if you just take a breath in, just like before, we're just going to feel for your spleen. Okay. And out. And again. And out. And again. And again. And out. And again. Good. And one final time. Good. Now we're just going to do the same, just going to tap across, feeling for your spleen again. So I can't feel any dullness there, but sometimes you might hear that with the spleen. Have you been to the toilet for a wee recently? So I just want to feel for your bladder. You have, fine. Okay, so just tap down from the umbilicus. Ideally go down to the pubis. Fine. Just going to feel for your kidneys now, sir. So my top hand I'm just going to push slightly deeper on your abdomen, and I'm just going to flick from behind. Good. So I can't put it there. I'm just on this side. That's fine. Just going to have a little listen on your abdomen now, sir. So listening for ideally 30 seconds in 3 different places. Okay. So ideally you listen in 3 different places, and bowel sounds can be present, absent, tinkling, or other changes that might be present. I also like to listen for a renal period. At this point I do superior and lateral to the umbilicus, so just listen now. Okay. That's fine. And just to finish off this examination, so I'd just like to feel in your abdomen to feel for your aorta. That's okay. Feel that. Pulsatile but not expansile. That's fine. Okay, sir, so that completes my examination of your abdomen. Would you like any help getting dressed at all?
That's fine, thank you.
Thank you very much. So I'll wash my hands. And to complete my examination, I'd like to take a full history, do a systems review. I would like to do an inguinal examination, an examination of external genitalia, and in addition I'd like to perform PR and urine dipstick. Thank you very much.